So good afternoon, all. Welcome to the expert series held by NATHEALTH. So I am Chirag from the Western region lead. And for today's expert series discussion is regarding health, using innovation to leverage health testing, uh, wellness and preventive health testing. So as India has as India's growth has increased, as the income have risen constantly, the country's disease burden also has shifted. In 2016, the majority of the deaths in India, 61.8%, were due to non-communicable diseases, NCDs, such as cardiovascular and chronic respiratory disease. Whereas in 1990s, the majority of the deaths, 53.6%, were due to communicable maternal and neonatal diseases. India's healthcare system faces multi-pronged challenges. NCDs increasing threaten the physical health and the economic security of many lower and middle income people. And also the challenges from the infectious disease also still persist in the country. India ranks second in the world prevalence of diabetes, according to International Diabetes Federation. Healthcare delivery in India requires a massive change in every stage, including prevention, diagnosis, and treatment, and requires integration of care from each of those stages. In this session, we aim to get valuable insights from our expert panel who are the pioneers in healthcare diagnostics domain. So it's my privilege to introduce one of the pioneers, one of the speakers. So one of the speakers is Mr. Hasmukh, who is the managing director and the co-founder of MyLab Solutions. Mr. Hasmukh is a biotechnologist turned into an entrepreneur and holds a postgraduate degree in medical biotechnology. Hasmukh has a deep experience of commercial development of the applied molecular diagnostic solutions. He drives product strategy and new innovations at MyLab. MyLab, a company, provides a portfolio of diagnostic kits of pathogen detection and viral load monitoring. MyLab Discovery Solutions began with an idea to simplify the complex nature of diseases detection, making it more affordable and bringing cutting-edge science and technology to everyday detection. In just few years, the idea that has evolved into a best-in-class products and services that empower the work of many hospitals and laboratories globally. Our next eminent speaker is from NM Medical. NM Medical, Mr. Rahil Shah is the CEO and director of NM Medical. So Mr. Rahil Shah has completed his management at finance at Wharton School, University of Pennsylvania, Philadelphia in 2007. He returned to Mumbai after a short stint with Microsoft Health Solution Groups in Seattle. In the last 10 years, he has been with NM Medical. He has helped to grow the chain started by his father in 1981 to 15 locations with full-fledged diagnostic services. He has the passion of technology and sees big potential in using tech for service innovation. So NM Medical, one of the pioneer in diagnostic testing, NM Medical has raised the bar of preventive health checkup in India. With the end-to-end technologies, imaging, and non-invasive cardiology services, the NM world ensures the advancement at every step. So our next eminent speaker is a doctor. So I would like to welcome Dr. Amit. So Dr. Amit has a degree, MBBS, DMRD, DNB, PhD, and FIRC. His area of specialization is radiology. His keen interest is in artificial intelligence, big data, and he has more than 70 publications. He has been awarded Suren Kothari Memorial Oration in 220, KM Medical at 218, Fellowship from ICRI in 216, Ashok Mukherjee Oration at 214. The area of interest is deploying AI in the point point care imaging, public health screening. So Deep Tech is an artificial intelligence company, a company which aims to equip healthcare caregivers with the power of AI. Its power has the potential to transform healthcare radically. Deep Tech vision is to provide cutting edge solutions powered by deep learning algorithms that will bridge the wide gap in the imaging sector. Bridging the gap will empower imaging experts, radiologists, physicians, patients, government decision makers, and non-profit organizations with the power that they can systemize the imaging flow dynamics. Welcome to all of the eminent speakers today. So let me start up with Mr. Rahil as one of the points that you would like to have an individual session on. So, Mr. Rahil, over to you for the individual session where you will be covering evolution of health checkup over the years and best practices.
Thank you, Chirag, for that introduction, and thank you for having me on this panel today. Hopefully, we can share some good insights from our 2 decades plus of experience of providing health checkups in a variety of formats at a fairly large number of locations in India. So let me start out by saying that today we're at an inflection point with health checks in the country. There's more buzz around this word of preventive health checkup and wellness than there ever has been in the previous 2 decades. And perhaps if there's one positive legacy of COVID, it is that individuals are now more conscious about their health and more proactive about taking care of it. However, most of this growth and explosion in volume of wellness and health checks in recent years has come from lab-driven wellness testing, where wellness profiles typically include a battery of lab tests that can be performed at a laboratory, at a collection center of that laboratory, or with great convenience, even at home, and at an affordable price point. So what that means is that suddenly the market for health check, which used to be fairly niche in nature, fairly restricted in nature, has now multiplied 100-fold with the understanding that one should at least adopt lab testing as a first avenue of wellness, if not a complete comprehensive health testing portfolio. So while that's been wonderful, and we welcome as a service provider, we welcome the increased awareness and adoption of preventive healthcare in the country as a result, I think it's important to understand the differentiation between a lab-only wellness profile and a comprehensive health check that covers everything from head to toe. An ideal health checkup program should include your laboratory tests. It should include radiology tests as well. It should include non-invasive cardiology tests, and it should include a series of consultations, including a post-checkup consultation after the health check, to guide the individual on what the implications, actual clinical implications of the findings are, and what follow-up that individual may need or may not need based on the results. That's the correct comprehensive approach to a health check exam. Now, it goes without saying that the accessibility to that kind of a health check program is always going to be limited vis-a-vis a complete lab testing driven wellness profile. And as long as an individual understands the limitations of adopting a lab testing only profile and understands that that may be suitable for a younger population or for a population that is at lower medical risk, that's good enough. But certainly it's important to recognize that for a population that's above the age of 35 to 40 years, for a population that is exposed to various health risk factors, it could be something as simple as stress, which is an integral part now of all our corporate lifestyles. The moment those pictures come into play, it is important to adopt a comprehensive health check approach. One of the legacies that this health checkup adoption, or 2 legacies rather, that have emerged from the adoption of health checkup across the industry. One is there is a tremendous improvement in the service experience for the patient. Everyone understands or understood over a period of time that someone coming for a health check is not sick, and therefore providing that health checkup program in an environment that is medical in nature, or has the typical hospital or medical smell, doesn't go in generating a wide response for health checks. So what we've seen is a significant investment in dedicated areas for wellness programs, And over a period of time, that's proliferated to the service environment as a whole for that particular healthcare provider, whether it be a diagnostic center, whether it be a hospital. The environment in which tests are provided today are very different from what they used to be 10 or 15 years ago. And I give full credit to health checkups for enabling that. Second, a good health check program has resulted in a very tight, comprehensive delivery or presentation of results. So a clinician or a patient no longer has to pull up a report from 3 different files or pull out a film from 2 different folders. Everything is very neatly packaged, whether in electronic format or in hard copy, with nice graphical trend results for patients who are coming year after year for their health checks, and is, at one click of a button or one glance through a file, is available in a very neat and systematic manner to get a comprehensive assessment of the individual's health. So both of those I will give credit to health checkup programs for bringing about. Now, taking a little bit more of a deep dive into the evolution of health checkups over the years, honestly, if you look at where the health checkup offering is today compared to where it was when we first started about 20, 25 years ago, it's not too different. Even at that time, we were essentially performing the same set of tests that we're performing today. Maybe a few tests like DEXA for osteoporosis or cancer markers or cardiac risk markers have gotten added to these packages, A, because the costs of doing these tests have come down, B, there's a greater clinical awareness about the importance of doing these tests and therefore increased adoption and acceptance from clinicians. But by and large, there really hasn't been much of a change. And most of the growth that I alluded to in the wellness space has come from new first-time subscribers to wellness programs. For an individual who's undergoing a health check year after year, I would imagine that there would be fatigue settling in, a plateauing of the way health checks are offered, and maybe even a negative growth rate and some dropouts in the number of individuals who are actually coming back every year to get their health checks done. So that is why I come back to my original point that, the industry is at an inflection point where there is a need for innovation in the way this comprehensive health check program is delivered. And some of the areas that I expect to see in the next 5 years, not too far away, I'll touch upon them. So first, I would expect a significant increased adoption of genetic testing into health check programs. So today, we're at a preventive mode with the adoption of genetic testing for various lifestyle diseases such as obesity, hypertension, cardiac disease, diabetes. One is able to move to a predictive mode where for those individuals who are at an elevated genetic risk of having these lifestyle diseases or cancer for that matter, a number of proactive steps can be taken to at least reduce their environmental risk for getting exposed to that disease. That could be more proactive screening on a regular basis. It could mean lifestyle intervention in changing some of their lifestyle habits. It could mean more focused testing for particular areas where they're at higher genetic risk. So certainly with availability of genetic testing now increasing and cost for these kinds of tests coming down, I would imagine that a lot of comprehensive health check programs will now incorporate genetic testing. The other change I expect to see is a change in the mix of focus areas. So typically health check programs focus on cardiac disease, focus on diabetes, focus on hypertension, which is great. In recent years, we've seen a little bit of an increased focus on cancer. But I would think that there are a few newer areas of focus that will come into play as well. The first area that comes to mind is gut microbiome. There's a lot of research published on how gut microbiome, a healthy gut, contributes to significant wellness across various organs in the body. And that testing will now become more mainstream in India as it is in the Western world. The other area where I expect to see some focus is sleep apnea testing. So again, there's so much research on healthy sleep being a contributor to good health, or for that matter, disturbed sleep being a significant contributor to a wide range of health conditions. Accessible and affordable sleep apnea testing is something that I expect to get incorporated into wellness profiles. And I would expect to see a greater contribution on neuro health. Today, particularly for an aging population, we don't really have a good preventive program that can look at things like dementia, for example. But I'm on the board of a few companies where there's very interesting work being done with a 5-minute MRI exam, for example, that can quantitatively assess your brain and predict risk of dementia, stroke, epilepsy, wide range of neuro conditions where if we have an indication that an individual is predisposed or those conditions are around the corner, timely intervention can be life-saving. The other change I would imagine that will come today, the health checkup program is, one element of the overall care of the individual. It really functions in isolation. In between the annual health checkups for an individual, if someone falls sick, there's very little reference made to the previous health check done for that person. The sickness episode is again treated in isolation, and then the individual again comes back for a health check in the following year. All of this, I think, with the evolution of AI into healthcare now, this will change significantly. One can imagine that a patient's medical history, past health checkups, genetic information can be synthesized into a comprehensive medical record that would be available at the click of a button, whereby a treating clinician for a particular episode of sickness would be able to incorporate all that information into managing the sickness for that individual. So the integration of data from a preventive and predictive health checkup program is something that we should see becoming mainstream in the next 2 or 3 years. The last area that I expect to see change on, so I spoke about the need for a comprehensive health check program. Now, the moment you incorporate radiology tests and cardiology tests into your health check, there are challenges not only of availability of equipment and centers or hospitals where these tests can be done, but there is a need for trained personnel to interpret and report those tests. And those are in short supply. We know that in India, our radiologists and cardiologists are very busy treating symptomatic patients, are very busy in diagnostic workup, and therefore adding a significant health checkup workload to them may be a challenge. Again, with the evolution of AI in this space, I would expect that a lot of this screening, particularly for normal results, normal chest x-rays, normal 2D echoes, normal abdominal ultrasounds, AI can help screen a significant chunk of those and leave a limited workload for abnormal cases for the radiologist or cardiologist to actually view in person. A little bit like how pathology has evolved over the years, where machines and middleware are able to automate a lot of the tasks that a pathologist used to perform manually previously. So that's my flavor on where we can expect to see health checks to go. As we're done with the individual sessions, I would be happy to answer any questions that the audience may have.
Absolutely. Thank you. Thank you, Rahil, for your deep insights on it. So one of the points that you have prioritized, it's in AI health, AI being the next generation of healthcare. So I would like to invite our next speaker, Dr. Amit Karat. So they specializes in AI in health checkup. So, Mr. Amit, can you just please tell us something regarding AI in health checkup and the future prospects? Over to you, Mr. Amit.
Thanks, Chirag, and indeed thanks for the entire panel for allowing me to present at this interesting seminar. And thanks, Rahil, for a good background in terms of how diagnostics are changing the medical imaging space. And let me just use a few slides for assistance to kind of walk you through this process and see how at Deep Tech we are doing the same. Primarily the role being diagnostics, but specifically concentrating on the X-ray chest as a unique tool for public health screening. So as you can see, we have a tool called Genki. It's used for public health screening. It has been used extensively for COVID as well during the COVID period. Primary role is to ensure that we have normal healthy individuals in the population to ensure quick healthcare checkups at corporates, at government public health screening programs, or even at on an edge device in the periphery where there is no internet access. The word Genki basically stands for healthy. It's a Japanese word for healthy, and that's what the tool does. Consider a regular case scenario where a patient or a group of patients are getting scanned. One of the important investigation that's ordered an X-ray chest apart from a list of lab exams. Typically, patient undergoes registration and then he undergoes an X-ray chest. What a tool like Genki does is that on the edge, immediately when the scan is done, almost instantaneously or near instantaneously, it gives out a result saying whether the X-ray is normal or not. And if it's abnormal, then what are the different likely pathologies on a given set of X-rays. And this can be in a mobile van setting. It can be in a corporate healthcare setting. Now, as we know, equipments are getting miniaturized, so we can have smaller X-ray equipments which can also embed this panel, or it can also be in a hospital setting where this unit can be plugged to a basic X-ray machine. This can work on X-ray, which are even conventional CR equipments or DR equipments, and based on the output given by this, either a sputum sample or a swab can be collected, or the patient can exit. Though it's a completely edge system, it can also sync with the cloud as and when it gets access to internet, and then basically it gets a lot of additional benefits in terms of, typically on an edge system, typically 4 or 8 AI models are available based on the capability of that particular device, edge device. But the moment we sync it to the cloud, access improves to more than 20 different AI solutions. Over and above that, there can also be an expert in the loop, like a radiologist or a physician who can basically look at the output of the AI and audit the AI. Not only that, there are a lot of interesting analytics that can come to picture, and this could be used by nodal officers, healthcare managers, floor administrators to really run the program effectively. Also, it can connect with international or national databases for health screening. Typically in India, for tuberculosis screening, there is NICSHE, but there are other different databases as well. And that's the advantage when the edge syncs with the hub and then to a national database. So that's how a typical solution looks like. It basically makes an X-ray machine intelligent. And as a result, even if there is no immediate doctor available at site, at least the AI is able to do some pre-screening and give some analysis whether there is abnormality in the X-ray, where is the abnormality, what are the potential likely differential diagnosis for that abnormality. The best part being is that it is completely portable. It works without access to even electricity if there is no electricity there. Triaging is less than 30 seconds to 1 minute, and it is a complete offline solution. But as I said, this system can sync with the hub as and when it can get access to internet. Up to 5 different X-ray machines can connect to one edge system. And from there, basically, it can give the outputs, or up to 5 vans can connect to one system, provided they are in the same LAN or a WAN network. And the moment it syncs to the hub system, then we can give users, which could be physicians, it could be imaging experts, it could be floor administrators or patients, access to the results and imaging as a SMS, email, WhatsApp, and that is all feasible through the hub solution. Just to show you a few outputs, how the system looks and what are the different functionalities of the system. The system has been implemented now. Close to 5 to 6 different states are using the system. It's more than 200,000 patients have been screened. This is one case study in Chennai where we have been implementing this system for now 3 years across 7 vans, and where the social impact has been that pre-implementation of the AI intervention, around 20 patients were being screened for every 100,000 or being detected. Now it has improved to 500 per 100,000. When we talk about AI, the first and most important benchmark is how does it perform as compared to human experts. And that's the accuracy AI metrics for our model. And these are as good as human experts. So these have been tested by important organizations which are working in this space, like Stop TB, and also FIT, which is Friends for International Tuberculosis Relief, which is a Vietnam-based organization. And the red line shows the deep tech AI performance compared to 11 other different AI softwares. The white dot indicates an expert reader with 5 years of experience, and the black dot indicates an expert radiologist, a reader with more than 25 years of experience. And you can see that AI for point solutions, for narrow solutions, exceed the field reader and matches human expert with more than 25 years of experience. The same paper is now in Nature Scientific Reports, where these 12 different AI models have been audited. So that's not the only thing that AI does. And as Ryan was saying, that we are seeing it almost in every space. It's seen in MR imaging, it's in CT imaging. On X-ray itself, apart from the tuberculosis or any infectious diseases, this was also used for COVID screening during COVID period. But there are about 20 different pathologies that can be picked up using AI. This includes ICU settings, public health screening settings, or OPD settings. This includes communicable, non-communicable diseases, like, for example, cardiomegaly, which is a marker of hypertension, or lung nodules, which is a marker of cancer or infection, pneumonias, which could be COVID or any other non-communicable, other communicable diseases as well. One of the challenges by using AI is that the AI basically can, if you see the X-rays on the left-hand side, they all are normal X-rays, but taken a different acquisition parameter belonging to different patients. And as a result of this, you can see that they have different signatures in terms of how the AI model looks and reviews them, but they all are normal. And that's one of the important things about AI is the AI needs to be robust. The AI needs to ensure that there is no data drift or a model decay when you deploy AI. And that's the reason what we propose is an expert in the loop model. That is, when we enter any intervention, we basically understand the local system, how it works, and then we give a kind of a proper architecture and diagram in terms as to how this system needs to be deployed in the given setting, where we have a different phases wise approach, where a few x-rays from every phase will be given for a human expert audit. And on that basis, this audit kind of reduces as the model performances can be consistently demonstrated on that. And that's extremely important phase-wise kind of deployment of AI. And that's true for any AI deployment in current practices, not only for chest, but also for rest of the medical images. There's a few of our certifications. So what is the system, what value this AI systems are bringing in? First of all, it acts like a expert in a completely in a situation where it's very difficult to reach experts, specifically in periphery, in settings today, even in corporate hospitals or any other. I think experts are not available even for X-ray reads because of the low RUVs associated with that. Most important is that the triaging happens in seconds, so results are available is instantaneous. There is an expert in the loop who's available when it syncs to the cloud. The yields are super high when we use an AI-based intervention. It can detect number of pathologies, not only for the given intervention, but for any other different kind of interventions. And over and above that, it is quite flexible. It could be used as edge or hub. It can sync. And for pediatric patients, there's 100% expert review. Just to showcase that AI models are not necessarily limited to lungs alone. We primarily are working in so many different spaces. It includes brain, breast imaging, where it detects microcalcifications or suspected triaging for any cancer. And either we bring them to our partners directly or through our partners as well, who come onto the platform and bring that solution. So that's the X-ray chest solution, but there are other solutions. And the next few years, these solutions are going to come in a very large scale into medical imaging. And these point solutions are going to make diagnosis on those particular conditions extremely easy, extremely elaborate, extremely structured, and they're going to therefore help physicians or experts in easy deployment of this into the existing radiology workflows. But that's a two bit about what we are doing and how our focus has been on X-ray chest AI model interventions in medical imaging, primarily decided towards public health screening programs to deciding about healthy adults or healthy pediatric patients. Thank you so much.
Thank you, Dr. Amit, for your insights regarding AI. So right now we have discussed regarding the evolution of the diagnostics and also the future of it. So it boils down to two things. So one thing is affordability and one is accessibility. So I would like to invite our next speaker, Mr. Hasmukh, to talk about innovation. How can it affect by how can it focus on accessibility and affordability? Over to you, Mr. Hasmukh.
Thank you, Chiragji. I think most of my points are already covered by Rahil, where he also foresee a future where we want to look into integration of most of the technologies to bring a preventive health closer to the customer. Though these are all very important methods of preventive care, also saving lives, what I feel also is there's still a complex method of delivery of this solutions. The lab has to do all the hard work today to make sure that the tests are done in time and delivered to the patients. And even at the lab end, most of the technologies which are currently being deployed to make sure that this kind of preventive testing happens and the report comes to the user are still on similar technology which are developed for years. Tests like biochemistry, whether it is glucose, whether it is HB1AC, kidney profile, liver profile, they are still done by those traditional methods of machineries, and they're kind of automation which has improved on it. But all of this happens at a lab level. If we really see value in preventive care, and if we see that it saves a lot instead of going to a curative care method, preventive care can save a lot of healthcare costs, not only to the individual but also to the government. The efforts have to made making sure that these tests are done accessibly and affordably by anybody and everybody in the world. I think we can start with PHC centers where we can bring this kind of technology in an easier way, and to make sure that anybody and everybody can test themselves, have their preventive care. The most important aspect also in this is building AI and machine learning algorithms on this. Government is also bringing digital health card for everybody. The value of it will eventually come as more and more data will keep emerging on this. What it does mean is you will be able to longitudinally see what kind of health profile you are carrying, what kind of improvements it need to have, and what kind of healthcare cost you can save, provided you have the information today. And to do this, it's not only the digital record or digital record management for the people, but also making sure that this kind of testing can be done accessibly and affordably by everybody. Even for the lab, if we have to give them methods where right at the time of collection, can they do the most of the preventive checkups on the spot and saving time of transport, bringing to the lab, having a technician on desk and getting it done. So this is where I think most of the innovation should happen. Most of the world is already working on bringing tests closer to the patient. The one of the innovation where we have done is, rather than a collection center, the phlebotomists are going home and getting these samples collected for the user. But I think it's time where the delight of the customers or the patients who are looking into wellness as a care has to go one extra mile. If this test needs 15 to 20 minutes to happen on the platform, can we really bring these platforms by making smaller, efficient, and closer to the user, where they can have these reports within half an hour or so, rather than waiting for a day or couple of days to have these reports. So I think this kind of innovations in this space, bringing the access and bringing the affordability is very, very important. We have seen what game-changing revolution glucose tests, simple glucose tests have done. Now everybody who has a fear of diabetes or who are already having diabetes, they have point of care platform with themselves, and they do track their records. Now let's go extra mile today with the platform like Abbott, where even at the real time your diabetologist can check your glucose level in the body, and can just give you a call, and if they think there's something going wrong, you can just get consulted. So this kind of preventive method, where before the damage happens, if you can know the advancement of the biological markers efficiently, it would be a game changer. And I think it is effort of manufacturing companies like us, the delivery solution companies like NM Medical, and all and most of the groups in NATHEALTH. If we work together in making sure that if we can bring this high-end biomarker detection in a preventive method closer to the user in faster method, I think it's an opportunity for everybody. It's time where healthcare industry should also revolve, add imaging, add clinical pathology, and add IVD tests more closer, more faster, and more efficient manner to the user. If we do that, I think it's a big opportunity for everybody to make India and the world healthier. Thank you, Chirag.
Thank you, Mr. Asmukh. Thank you for your insights. So yes, so for a few questions from the viewers' point of view. So yeah, so it's a two question intact. So we see the trend in India. We have much more of a curative approach to everything. Somebody gets sick, we go there, but we don't have the preventive approach, because as you say that preventive is better than curative. So so why is there the mindset that we have the curative approach? Why is it there? And what has diagnostics as played in the recent years that has changed the mindset of the people from a curative to a preventive mindset? So I would like to start off with Mr. Rahil Shah. So you guys can give your thoughts on that. So over to you, Mr. Rahil.
So I think that when you look at the way the Indian healthcare system is structured, right, the only part of healthcare delivery that gets reimbursed today, whether through private insurance, government schemes, or public health, is curative care. There is no motivation given to an individual from a reimbursement standpoint to invest in preventive care. Yes, there's a small tax benefit for health checkups, spend up to 5,000 rupees a year, but that's barely moving the needle. It's not enough. The moment we see widespread adoption of a preventive approach in the health insurance policies of large insurance players in the country, or in large government healthcare schemes where there is a motivation for an individual to undergo a health check, I think the scenario will change completely. Because today, otherwise, preventive health check is just pay out of pocket, or for a company, sponsoring health checks for their employees. It's an additional expense over and above the health insurance policy that they're taking for their employees. So that's one primary cause why we always focus on curative rather than preventive, and how it can potentially be addressed. Having said that, I think that some of the health episodes that people have gone through, particularly during COVID, has now accelerated in particularly in urban areas, the need for being more proactive about your health, and for investing more time and money into taking care of your health. As Hasmukh said, there is also an increased expectation now of quick turnaround. People don't want to wait for results for 2 days for their reports. They want digital engagement. And there are a number of players that have jumped onto the bandwagon with an online and digital presence to kind of create more awareness about the need for a quick, easy health check with fast results. So a combination of all of that is fueling more adoption among individuals and a greater awareness. But we're still some way away from where we ideally need to be.
Thank you. Those were some things. We should think about it because the burden that India is facing right now, it's tremendous with the non-communicable diseases shooting up high. So the same, I would like to know thoughts from the same question is on the table. So I would like to know the thoughts from Dr. Amit on the same thing itself. Over to you, Dr. Amit.
Yeah, I think just to add to what Rahil said, I think it's the question of 3 A's: accessibility, availability, and affordability. I think medical imaging over a period of time, the affordability of that has increased, and the accessibility of medical imaging has increased. Not only there is a push from the private sector, corporate sector, also there is a push from the government sector as well. And of course, the access even at remote settings, this getting increased. I think that is important driver in this change. Insurance will definitely support, and I think corporate organizations and others also very important. But I think the 3 A's, the accessibility, the availability, the affordability, has over the period of time. There's also awareness. That's the 4th A. So there's a lot of awareness towards now personal health, and that is also driving this change. And I think as a result of this, we can see the change in mindset and people moving towards preventive care. And I think that should be the focus moving forward as well.
Thank you, Dr. Amit, for your insights. Absolutely. So over to you, Mr. Hasmukh. I would like to know your insights on the same.
So just to add to Rahil and Dr. Amit, as Rahil rightly said, if in India a person is spending 100 rupees on his treatment, 70 rupees goes at least from their pocket, either from the patient's or patient's family. And when we are looking at a country where the per capita income is very, very, very low, the tendency of the individual goes to spend only on something which is broken. If and every attention will only go in a curative approach. And this is where it's not only the mindset of the individual, it's the government, the policy making, the guys who are working in the healthcare industry. Everybody will try to focus on curative approach, because we have very little to spend, and when we're looking at very little to spend, it is more on a curative than a preventive approach. Of course, COVID has given a lot of awareness to the people. If you see very recently, the revenue of the giant companies in medical who are working in diagnostic, their 15% plus revenue is now on preventive healthcare. It shows that the market is ready to go in a preventive approach. There are a lot of incentives which come with it. You can have a proper healthcare plan, nutraceutical plan, vaccination plan, therapeutic plan, and so on. But at the same time, on the second point, where we see that the diagnostic companies are doing good, they're now going at least 15% of the revenue on preventive approaches. We also see that it may not be always appreciated. Let's say if I'm doing a preventive test, my doctor may say that why you did it. Uh, this kind of parameters were not needed. I need these parameters, and you do the test again with these kind of things. The doctor may not be even comfortable to use those preventive measures. Also, even I may not have enough knowledge to what to do with this. If there is some indication, I don't know what kind of medicine, what kind of nutraceutical, because it's not only one parameter at a time. It's most of when the doctor look at you, it's many things they look into in conjugation. So I think the whole ecosystem, so diagnostic is playing its role very well, but but making the ecosystem around hospital doctors, nutraceutical planning, using these reports, how we can club those, how government can support those, I think all these initiatives are needed. Diagnostic is playing its role very well, and it's a beginning. And if we see 15% of the revenue from 0% maybe 10 or 15 years back on preventive healthcare, I think it's a big, it's those slow, but it's a good beginning for everybody.
Thank you, Mr. Smuk, for your inputs on that. So I would like to move to the next question. So, you guys are the players in right now, the diagnostic world. So with the advent of digital solutions, what are the new factors that has played a significant role in changing the mindset? So I would like to initiate the question with Dr. Amit. So over to you, Mr. Dr. Amit.
Yeah, Chirag, I think in terms of digital solutions, I believe the innovations which are happening in the NLP space, big data, deep learning, machine learning, they are one of the most important driving forces of change in the healthcare. You must have seen last few years only these changes are so common or so frequently seen, and we are seeing so many new healthcare companies, startups, even corporates, those who have been there in this business for more than 20 plus years, all kind of innovating using these new technologies. The reason why these changes have happened is I think we have now seen enough examples from the retail space or the financial space. We have seen these examples being used in these services and we are seeing results. We know that AI bots work to some extent, specifically in the banking sector. We also see that big data and AI have given so much, a lot of insights, which has resulted in so much new innovations coming in these spaces. And the same replicas are now started getting seen in the healthcare space. Healthcare being very tightly regulated space where data also is not that easily available because it resides in silos, and a lot of regulations, it changes with every geography. There has been challenges, but now there are ways in which we can move over those challenges, and that's why we are seeing these unique changes. Also, we see that low-cost kits and diagnostics for cancer or for infections are now easily available because of these innovations. And as a result of this, we are seeing that the waiting time for patients have reduced significantly. Hasmukh and Rahil have spoken in detail about that. And a lot of population can now access this. And the physicians are benefiting because they can see that their worklists are getting prioritized, or they're able to access critical patients first, or they're able to give attention to those cases which are abnormal or having high level of abnormality within them. And all these are the digital revolution is playing a big part. But as I said, that it is just a starting point. It's just, as Rahil said rightly, it's the inflection point. It's just going to evolve into extremely large AI product portfolio in the coming future. It's going to get very complex at the same time, and putting the right systems and frame in place so that all these can be easily imbibed. So organizations can have their policies in place when they incorporate new products and services into the workflow. Otherwise, it will be more like a Scotch tape approach where every new product will have to be stuck into the system, and that's a long-term planning that will be required in the near future. So that's a few of my kind of thoughts on this particular aspect as well. Thanks, Chirag.
Thank you, Dr. Anit. That was wonderful. So I would like to give the thing to Mr. Rahil. So can you give your inputs on that?
Yeah, the one point I would add is that, today with health checkup and screening programs, we work with a one-size-fits-all approach. It's not, targeted. Whereas if you look at most other disciplines of medicine, oncology, for example, precision medicine is a new buzzword, personalized medicine, where each individual is treated based on the the medical history, genetic profile of that particular person. I think with health checks as well, the future, as data gets synthesized better and is more easily available to a clinician or a patient for that matter, a lot of these decisions can be made by patients themselves over a period of time. One can have a very targeted approach on what kind of testing requires regular follow-up, what kind of testing may require, once in a while kind of follow-up, and what kind of testing would not be applicable at all for this particular patient. So that would be another great contribution of digitization in this space that would benefit the patient. The other area that we can expect to see, and we're already seeing some movement on, is the evolution of these digital healthcare marketplaces. As a patient today, instead of dealing with 4 or 5 different service providers for their healthcare needs, a digital healthcare marketplace will give the opportunity to engage in with just one provider for all the healthcare needs, ranging from primary care to diagnostics, pharmacy, secondary care, tertiary care. I don't think we're too far away from that being enabled, where a family physician is also in the loop on that platform. And all the digitized radiology data from providers like Amit, or all the molecular data that's generated from all the kits created by companies like My Labs is available on that platform.
Thank you, Rahil, for your insights. Over to you, Mr. Hasmukh. You can please give your insights on this.
I think first thing which digital solution have changed in diagnostic is lot of marketing. If I see open my mobile, I see at least tens of promotion about wellness, digital care, online doctors, and so on. So I think acquiring the customer on the ecosystem is what digital ecosystem is doing, as Rahil bhai also rightly said. But also at the same time, what we have also seen, which maybe 10 years before I would have been fantasizing about this, is a real-time check monitoring by let's say by a diabetologist about the diabetes method of patient. And let's say for sleep based screening, you don't need to go and sleep in a doctor to analyze your sleep pattern. Now you can do at a comfort of your home, and still the doctor digitally can see this. I was also reading a report about from Stanford University a few months back, where they were also saying that most of the improvement in digital and AI will happen in healthcare, almost close to 50%, and that's where the whole world is going to move on. The most important here is, no matter how good we bring this digital solution, whether it is wearable, I think whether it is continuous monitoring, vaccine planning, effective telemedicine, precision medicine, biobanking, digitalized biobanking for the thing, and personalized treatment plan, until and unless we don't bring it affordable and accessible, it would still be a dream for many people. So I think digital involvement to make sure that all the advancement in technologies through AI method are brought affordably and accessibly is something where digital revolution will happen. And whether we wish it or not, it is going to happen. It's on us how soon we take we enter this bus, we catch the bus, and how much pie we take as a group.
Thank you, Mr. Hasmukh, for your insights on that. So coming to the part where where we focus on the policymakers and the regulators. So what role can regulators and policymakers contribute to bring the change in the shift of mindset from a curative to a preventive? So I would like to initiate this question with Mr. Rahil. So over to you, Mr. Rahil.
So I spoke a little bit about the need for insurance companies to adopt this into their policy framework, where either it could be something as simple as giving reduced premiums, for the following year if someone has undergone a health check, to various more innovative and complex models. But my lenses are restricted to looking at urban areas of the country, because that's where we have maximum experience with. But there's a much wider landscape out there beyond tier 1 cities. So over there, where insurance may not even have penetrated, it really comes down to increased engagement with the local health community centers, with village panchayats, with whoever the caretakers are in those areas, to incentivize individuals to come and at least get a basic set of tests done, like Hasmukh mentioned, that are affordable, and that can be sponsored as part of a public healthcare program. uh, at least for some period of time, if that happens, let's say for a period of 2 years, 3 years, and individuals then understand the value that that is bringing to, improving their health. For that period of time, there will have to be some financial support from public health outreach programs. After that, it can potentially become a hybrid model where there is some contribution from the individual, so it doesn't bleed the state coffers or the town coffers endlessly.
Thank you for your feedback, Mr. Rahil. So the same question over to you, Dr. Amit.
Yeah, just to add to what Ryan said, I think important is when new products or innovations enter the market. I think the first thing that regulatory bodies which are there, I think how they can streamline this entire process of the regulatory process for these innovations. And innovations are spanning so many different fields, right? And there could be so many different products actually coming to the market every month, few months. I think the most important is a broad policy document as to how these products will be tested, validated in this environment, and what can help a quick go-to-market for these products, provided that the validation and everything goes in the right direction. And then basically supporting through education, because these are new interventions, new programs. There is a lot of limited awareness amongst the general population in terms of how these technologies are going to work, where they are going to really create impact, where they are not going to create impact. And not only the general audience or the population needs to know, also the one in the entire healthcare machinery who are going to actually work around the system. Training will be required, a lot of immense training, some modifications in the workflow will be required. And these will be all be done through laying down proper framework by the regulators and the policy makers, and how to see that these products and solutions can be tested quickly, brought into the workflow quickly. And that changes from countries. And we have, since we are working out of India as well, we have seen that everywhere there are different policies, different guidelines, and different workflows. Quicker the process, the faster it is for these nations to adopt new technologies and ensure that the population benefits from these technologies.
Thank you, Dr. Amit, for your insights. So over to you, Mr. Hasmukh. You can give kindly give your insights on the same.
So I think regulators and policymakers decides the path where the technology will grow, where the health of the country will go. I think few years back before COVID, diagnostic players didn't had front seat in policy making, even in the consideration. I think with COVID, we have all realized that diagnostics will play very important role. And even if you see the number of spending that at a policy level, if you see countries, US spends around 20% of their GDP only on healthcare, and most of that goes on preventive. UK almost 10% plus, and they have shown that by giving such kind of attention, it improves the quality of life of the whole country and the ecosystem. I think such kind of attention is also needed at a regulation and policy level to make sure that the healthcare system or infrastructure gets enough attention in all budget planning for the country. I also feel that if we decide the regulation and policy to make sure that we build an infrastructure where the incentives are given on the wellness of the wellness of the profile of the individual rather than the episodic care, I think that would start changing the game. We save a lot if we know in right time than doing the whole spending once we are affected with the disease. We all know this, but if the problem is the current incentives are only when the care is happening, whether it is hospital, whether it's surgery, whether it is testing. If we just shift this little and give the incentive on the wellness profile of the individual, whether it is insurance, whether it is schemes of the government, and we just direct the policies around this, I think that would start changing the whole health of the country. Imagine, just to give you one example, India is a diabetics capital of the country, and out of all the diabetic people, 15% will have the food disease, diabetic foot. If we really plan in advance, and even if we save from this 15%, we save 5 to 10% of the episodic cases, imagine what saving we will have, and that can be again spent on the wellness of the country. So I think this kind of policy initiatives are very, very important. If the government at regulatory and policy level thinks about giving the front seat on the wellness, and then episodic work gets the second preference, I think eventually the whole system will drive moving towards it. That would be my call on this.
Thank you for your keen insights, Mr. Hasmukh. So I would like to move to our last question of the session. So the mindset right now, what we are facing, the curative mindset. So one or two things from each of the speakers that could help, that could help to change the mindset of the people, of the general people from a curative perspective, and they could also focus on the preventive perspective. So I would like to initiate with Mr. Rahil sir on your on this part itself. So over to you.
Yeah, I think it's already happening, to be honest. I don't see that as a major challenge. Today, if you ask 9 out of 10 people, in whichever part of the country, that would they like to do a preventive health checkup, I think the answer would be in principle, yes. But do they know where to go, how to do it, and how to afford it? The answers to probably all those three questions are no. So, yes, awareness about the need for preventive health checkup is important. But creating systems where that can actually be delivered at scale. Today, there is enough of an awareness already available and a large population available that would like to do it and will adopt it willingly. But within the industry ecosystem, both at a policy making level and at a service delivery level to the last mile, I don't think we're equipped to be able to achieve that. I really liked Amit's point as well about the fact that there are so many new technologies that are coming to market to provide, on the spot sort of health check preventive screening programs. But inevitably, they get caught up in regulatory quagmire. So, can we create a fast track process so that those solutions are available to a wider set of population much more quickly than what we're enabling today? So, I see that as being a greater problem than actually motivating an individual to undergo a health check.
Thank you, Rahil, for your insights. The next, I would like to ask Dr. Amit to give his valuable inputs on the same. Over to you, Dr. Amit.
Just to add, I think anything or any way we could promote organizations that are modernizing or driving the quality of healthcare, which are making patient-centric outcomes possible, organizations which are either improving the yield of diseases or helping us catch infections early, or supporting experts to improve productivity, or do a spot diagnosis. I think we need to ensure that how we can weave this all into the entire vision of the nation's health at the right up to the grassroots level, and how we can promote these new technologies and organizations at not only through insurance or through corporates or through the grassroots level in terms of a primary health center, or even at a corporate or a tertiary healthcare center. So I think that's where we are driving. It's all about how we are promoting, how we are giving precedence to organizations which are driving this change forward.
Thank you, Dr. Amit, for your insights. I would like Mr. Hasmukh to give his insights, and I think we are bang on time. Over to you, Mr. Hasmukh.
I think what Rahil and Dr. Amit has said, I'll also put forward my couple of points exactly aligning to them. Number one will be, of course, give incentives on wellness and not on the episodic care. That would be first, as I described. And second, I feel, is strengthening the primary healthcare system of the country. The capex and the energy we spend in making 1,000-bedded district level hospital, I think if we can do small 100 PHC centers, and if we give this to private player to manage efficiently, whether it is vaccination, treatment, diagnosis, planning, I think that is where we need to decentralize the whole testing algorithm for the country. And here there will be many questions of regulatory, many questions of approval. I think government need to be payer and regulator. They need not to manage this all. There are many efficient players like NM Medical, for example. They can manage diagnostic far well than most of the government organization may do. And I think the government can pay for the services. There is Ayushman Bharat scheme. There is a ABDM where we can link digitally and can vouch this. You don't need to run all this. I think they can vouch that it is regulated very well and it is paid for the efforts done by the private players. Private players can manage the PHC centers very well, whether it is staffing, whether it is vaccination, whether it is treatment, diagnosis, effective planning, maintaining the record, submitting those. I think private players can do it very efficiently and at a cost. And government can take the role of payer and regulator. And I think the whole ecosystem can help a country. Schemes like Ayushman Bharat itself is an initiative by government to make sure that it happens. ABDM is an additional thing, and I think India is moving towards a healthy profile eventually. Government understands this, and we are very hopeful that we'll be on right track for a healthy India very soon.
Absolutely. Thank you, Mr. Asmuk, for your insights on that. The middle path always help, and the win-win situation for the government and the private players always take the better of the healthcare system. Will always make the healthcare system better for India itself. With that note, I would like to conclude this session. I would like to thank each of the speakers to get their valuable time and give us some insights regarding what are their thoughts for the same. So thank you, guys. Thank you for being there.